everyone, how you doing? This is your girl again, Folakemi Adebayo, on our channel on Nutri Healthy Lifestyle. So today we'll still be talking about our topic diabetes, and today is on our goal of treatment. If you recap from our previous video, I talked about types of diabetes. I talked about diabetes type 1 and type 2. So I'll be focusing more on type 1 today, and then a subsequent video will talk more about type 2. So as we all know, for type 1 diabetes, people that are affected usually don't produce insulin. It's like a genetic abnormality where their immune system attack themselves and destroy the beta cells that produces insulin in the body. So people that have this condition, it's very rare. Actually, it's like maybe 10 to 15% of people who have it don't produce insulin at all. So therefore, once it is discovered that they have type 1 diabetes, the next thing their doctor wants to do is to jump them on insulin, and that's where I really want to focus on for today, insulin. So once you are placed on insulin, you have to follow your insulin regimen, and that's where the education comes in. If you are taking your insulin, it's advisable for you to follow up with your diabetic clinic, because in the clinic you have doctors, nurse practitioners that are experts in that area. They're going to tell you and educate you on how to measure your own blood sugar yourself. If you refer to our previous video, I'd show you how to use the automated machine to check your blood sugar by yourself. So when you go to the clinic, your nurse will give you education on your sliding scale. Most likely you'll be placed on a sliding scale. Some people have medium, some people have the small scale sliding scale, and some people have the high scale sliding scale. So your nurse is going to educate you on how to inject yourself, how to check your blood sugar by yourself, and how to follow up with your clinic. Now if you go to the clinic, there are a lot of journals. In those journals, if you look through them and read through them, you have some websites that you can click. So once you click that website, it's going to take you to another page, and on that page sometimes they have videos that gives you demonstration on how to check your blood sugar and how to administer your insulin by yourself. They also have helplines. In case you are not sure about any numbers, you can give them phone call. They are always available 24/7. Now, I will advise you, if you have diabetic type 1, you have to carry your insulin and your blood glucose machine everywhere you go. Everywhere you go. And remember, when you are packing your insulin and you're taking along your blood glucose machine, you also have to pack some snacks along with you, some sugary snacks. And I'll tell you the reason why I advise you to go around with your sugary snacks. So the reason why is because if you're on insulin, you have to check your insulin before meals. You don't want to take your insulin without eating, and you don't want to eat without checking your insulin, without checking your blood sugar to know what your level is, so that you can administer your insulin yourself. Because if you're diabetic type 1, you're at risk of type 1 and type 2 are at risk of hypoglycemia, but if you are insulin dependent, you are at risk of developing hypoglycemia, especially if you don't eat your food on time, if you exercise and you didn't check your blood sugar and you exhausted all your blood glucose in your system, you're going to go into hypoglycemia. And when you're in hypoglycemia, remember your blood glucose level is going to drop below 70, and is very, very critical. If it drops below 70 and it keeps dropping further, and you did not eat on time, it's very dangerous, because you can collapse. You start feeling tired, you start shaking, your brain is exhausted because it needed sugar to function, your lungs, your heart, everywhere is starved. At that time, you are in a critical situation. And if you are not able to lay your hands on something reasonable or sugary to eat, it can be really delicate to your heart, to your whole body. I mean, you can go into coma, and if people around you are not aware that you are a diabetic patient, they might not know what to do, and it might be unfortunate and the person might just die like that. So I always advise that as you are packing your food, just make sure you have something sugary in your bag all the time. So in case you go into your hypoglycemia, you have something sweet to take immediately to boost up your glucose level. And again, I will always advise you to ice your insulin. If you are taking the regular insulin, or if you're taking like the other combination of insulin, always go around with them in case your blood sugar goes high. You don't want to risk DKA, because DKA is one of the complications of diabetic type 1, because DKA means if your blood sugar shoot up to a certain level, it's going to cause a serious complication for you, because what happened then now is that your body start breaking down fats, because your body is not recognizing the glucose in your system, so it's not pushing it into your cell, right? So you have excess sugar in your body and your body is not recognizing it because there's no insulin. So your body start breaking down fat, and the end product of fat will give you ketones, and ketone is very dangerous for the body. So when it gets too high, you run into DKA and you start getting dehydrated, potassium start running down, your heart is not beating properly, and that too can really be dangerous. So you really want to be on both sides. You want to be safe not to go into hypoglycemia, you want to be safe not to go into DKA. So you have to always prepare yourself. And another thing I want to advise you, if you're dependent on insulin, is that you have to keep like an alarm on your phone to always remind you. Although technology has advanced to some level that some people have medical hardware, this hardware comes in different form. Some people have it as a patch, they put it on their body, that checks their blood sugar all the time and alert them when they are running into hypo, or if they are going to hyper. That gives them like an indication. Another kind of hardware is some people also have insulin pump that they wear around, and that is very easy and comfortable, but it's quite pricey. I'm not sure if everybody is able to afford that, because what that does is it constantly check your blood sugar, and if you need insulin, it's going to automatically inject you the insulin, and if you are running hypo, it also will alert you. And all you need to do with such hardware is you just need to refill your insulin, check the battery if it's functioning properly. But if you are not really available to such opportunity, I would advise you to just follow up with your diabetic clinic, follow up with your doctor, your appointments. Don't miss your appointment. And if you are not sure with any of your numbers, or you don't really understand what your nurse or your doctor is talking about, I would advise you not to go ahead and just give yourself any form of insulin. Try and get an helpline number, call them before you inject yourself your insulin. All right, my next video I'll be talking about type 2 diabetes and some food and lifestyle that we have to adjust in order to reverse pre-diabetic, or if you have to just maintain yourself to reduce your glucose and insulin resistant level. Thank you very much for watching us today. Please, if you like my teaching, please click like, subscribe, and share my video, and I'll see you in my next subsequent video. Thank you very much for your time. God bless you. Have a good day.